And thank you, Arlene. And we are back. According to a study in the Journal of Pediatrics, researchers have found that the percentage of children with ear infections has gone down dramatically. What are parents and doctors doing differently? Well, our next guest believes there are several reasons why this is. And here to tell us more is pediatrician at St. Barnabas Hospital, and I should say the health system, Dr. Lisette Roblaito. And we thank you so much for coming and sharing with us.
Good morning.
Good morning.
How are you doing?
I'm doing good. I'm doing good. And kids are doing a whole lot better too, huh?
Yeah, it's actually really great. So they're referring to this really interesting study where they followed kids for about a year to see exactly what was impacting ear infections and how often kids were having ear infections. And really what we found is that the number of ear infections that happen in kids under the age of 1 have actually decreased dramatically. Mm-hmm. We definitely attribute some to people stopping smoking because smoking is a known factor to contribute to ear infections. Additionally, a lot of people are breastfeeding, and we absolutely know that breastfeeding helps protect children against ear infections. We obviously recommend breastfeeding for as long as possible, but definitely breastfeeding for the 6 months of life provides a lot of protection to kids for any infections. The interesting thing they found in this study is that kids get a lot of just general colds. Mm-hmm. So as a pediatrician, parents come in and they say, oh my gosh, my child gets sick all the time. Absolutely, it's absolutely true. Kids got a lot of infections in their study, but the question was how that had an impact on ear infections.
And for you, as a doctor, what do you see mostly?
So we do see a lot of ear infections. That's a good reason that parents bring in their kids. Mm-hmm. Their child wakes up in the middle of the night screaming, pain, have had a little bit of a cold, all of a sudden have a fever. So it's a really common complaint that pediatricians see. In 2013, the AAP, so the American Academy of Pediatrics, changed the recommendations for treating ear infections. So we're a little bit more conservative with antibiotics. We're trying to protect kids against getting a lot of extra antibiotics and unnecessary antibiotics. So they helped us out by giving us some recommendations, a little bit more strict recommendations. Some parents now and a lot of physicians now, depending on how old the child is, depending on how severe the symptoms are, and obviously depending on how the ear looks, will give the child 24, 48 hours of let's just wait and see how they do over the next 24, 48 hours, and you may not need antibiotics.
So a lot of people are withdrawing from the whole antibiotics as a whole.
Yes, and one of the most important things that I think a lot of parents forget because we're stressed out and we're worried about our child who's really uncomfortable, really miserable, is pain medication. So Tylenol or Motrin, depending on the age of your child, goes a long way in treating the pain and the fever that comes with ear infections. And so that's actually a really important thing. Lots of kids complain about ear pain in the middle of the night. Who wants to go to the emergency room? Who wants to go to urgent care in the middle of the night? So my recommendation always is first try Tylenol, try some Motrin depending again on how old your child is. But that may actually save you the time. Your child goes to sleep, your child calms down, and you can wait till the morning to call your pediatrician.
When we talk about ear infections, we hear them, they're frequent, kids have them. We know that, you're running to the doctor, we gotta take you for the ear infection. But what are some of the risks that come with ear infections? What comes afterwards?
So, certainly very few percentage of kids do have recurrent ear infections. So there's some kids who are just more prone to ear infections, get them way more frequently than others. You may have a child who never had an ear infection. You may have a child that gets an ear infection every single time they get a cold. Certainly the most worrisome thing with ear infections, it certainly can spread. So you can get infections in the bones around the ear. And you also can have some hearing loss, but usually that is not the case. We do get some ruptured eardrums, so the ear infections we're talking about right now are actually in the middle of the ear, not in the outside of the ear. So sometimes the eardrum ruptures. And the worst part is just a lot of fever and a lot of pain. I mean, really that's the big deal for, our little 2-year-olds, our little 15-month-olds. They're just so miserable. When they're miserable like that, they don't eat, they just don't want to do anything. And so I think that's actually the worst part of an ear infection, is that it's uncomfortable. It's really painful.
Are there any correlations with vaccines and ear infections?
Sure. So what we have started to see now that we have a lot of data, we introduced a vaccine. There was a vaccine that was updated in 2010, the Prevnar 13. Some of you guys may know. It's against strep pneumococcus, and we actually expanded the coverage in 2010. I believe it originated in 27. I can't remember when they started giving the vaccine. And actually, all the studies they have done, they've found when they actually look at ear infections and do studies to see what bacteria are growing in it, the number of strep, pneumo, has actually gone down in these cultures. So as we have vaccinated our kids, and it's one of the primary series, so it's the vaccines that kids get under one, we're finding that the infections, the ear infections, there's a lot less of this particular bacteria in those infections. So definitely we see a correlation. Also, ear infections are associated with colds. So the flu vaccine actually tends to help. Why? Not because it's directly impacting the ear infection, but because it's decreasing the rate of colds, URIs, really flu. And so kids are less likely to get a complication of an otitis media related to a cold or a flu. So definitely has a pretty good impact.
So if you have a child and somebody's watching right now, my child is going through it in the middle of the night, what is the best time to say, all right, we go to the doctor?
So it depends on how bad the pain is. I mean, if your child is in a lot of pain, has a fever of over 102, absolutely go see the doctor. At the end of the day, if you're worried enough about your child, you know your child better than anyone else does, call your doctor, make an appointment, have someone check it out. It's something you have to look at. The pediatrician actually has to look in the ear to be able to diagnose an ear infection. So it really just depends on how your child's doing. If your child's not eating, if they're not drinking, you definitely worry about other things like dehydration. So it depends on how sick your child looks. But if your child looks pretty sick, absolutely. Like I said, pain control is super important in the middle of the night. It might save you a midnight trip to the ER. It might save you a very stressful not sleeping night. And then you can call your pediatrician, someone you know, in the morning to see your child and someone who your child knows.
So in the borough, do you see more of a decrease, increase? How would you say?
So I've been in the Bronx only for about 5 years, and it certainly
That's a long time.
it certainly seems like it comes in crops, and it's not the thing I see the most. I see a lot of colds. I see a lot of people who come in with colds, a lot of kids who come in with colds, and parents certainly are worried about ear infections. But I actually don't see it that often. It's a pretty satisfying diagnosis to make because there's a very distinctive ear exam that you find, and so it's very gratifying. But certainly we don't see it as often as we see just regular run-of-the-mill colds, congestions, my child's not feeling well kind of thing.
And before we leave, any particular time of year that you see more?
So certainly when there's more colds around, there's going to be more ear infections. Ear infections are associated with colds. That's generally in the winter time. So if you see your child, or his friends or her friends with a lot of little colds, a lot of runny noses, that's when you're more likely to have a child with an ear infection.
All right, Dr. Lisette Roblaito, thanks so much for coming and sharing with us.
Thank you so much.
All righty. Got to take a quick break, but when we return, we're going to find out about our nation's leading, what's our nation's leading what? Our nation's leading, well, we'll find out more when we return in a moment.